Hi there, I'm Alasdair Baverstock reporting for CGTN out of Mexico. I'm here in the city of Monterrey, in the capital's and the state's largest hospital. This is the Hospital Metropolitano in Monterrey. It's the state's biggest hospital, and it also now is entirely devoted to COVID-19. And we're here reporting a story on how, as the COVID cases climb in Mexico, just how hospitals are being completely overwhelmed. This hospital previously to the COVID-19 pandemic had just 6 intensive care beds. This hospital now has 130, and every single one of those intensive care beds is occupied. And as you can see, the patients here, they are in a very bad way. They are on respirators, which the state has been able to import. And the hospital's management here tell us that out of all the patients who arrive here and go into intensive care, 40% die here in the hospital, and that even then, when it comes to their relatives wanting to visit them to identify bodies, it makes it very difficult because they simply don't want to come close to these places. As you can see, I'm in full protective clothing. I've got double gloves, I've got 2 face masks on, goggles, a visor, and 3 separate sets of scrubs and overalls, simply just to be in this place. And we've been invited into this intensive care unit specifically by the authorities, who say they want to hammer home the facts just how serious COVID-19 is. The authorities here say often when it comes to COVID, it's very difficult for people to see the real effects until it happens to a family member. You don't see inside the hospitals. You very rarely see patients who actually have COVID because they are either isolating or in hospitals themselves. And they say for a great frustration for medical staff in Mexico and around the world has been the fact that people simply don't use face masks. They ignore protocols, and many even say that, oh, perhaps COVID doesn't even exist. This here, as you can see behind me, this is the front line of the COVID-19 pandemic. And when it comes to protocols, you have to be extremely, extremely careful, because while young people, the authorities here tell us, may not be so at risk, they become carriers, and it gets passed to people like this, people in their 50s and 60s, diabetic people, obese people, people who are more at risk. And that is how the COVID virus spreads and devastates populations here in Mexico. Mexico has reopened for business following 3 months of lockdown. As of July, factories are opening, and the country is experiencing a spike in COVID-19 infections. And this hospitals here, which are already overrun, are struggling to keep up. So thank you for tuning in. You'll be able to see more in my news report on CGTN. I'm Alasdair Baverstock reporting for CGTN here in the Hospital Metropolitano, Monterrey, Mexico.